Alright, it's time to go over Coccidioidomycos, or Coxy for short. Our scene takes place in a presidio, which is the Spanish military settlement. And presidio rhymes with Coccidio, so that's a good way to remember it. And we're calling this drawing Presidio San Joaquin, and you'll understand why shortly. Now, presidios are very common in California and the southwestern United States, and it just so happens that this is exactly the geographical distribution of Coxy. And to hammer it in one more time, we're going to draw this fountain here that has a map of Coxy's distribution. Notice it's very different from the distribution of blasto and histo, so the location can really help be a dead giveaway. And this becomes especially important when you see that it is very similar to the other systemic fungi in the route of transmission and in symptoms. And the route of transmission is that Coxy is inhaled as a single arthroconidium, which normally resides within dust. Now, the chance of infection is greatly increased when there are large amounts of dust dispersed into the air. For example, frequent dust storms in the San Joaquin Valley of California cause a large incidence of Coccidioidomycoses, which is why another name for Coxy infection is San Joaquin Valley fever. So now you know why we call it Presidio San Joaquin. Additionally, large amounts of dust can be displaced following earthquakes. During the Northridge earthquake of '94 near Los Angeles, the incidence of Coxy infection increased tenfold. And of course, earthquakes are very common in California. So we're going to draw in some large cracks in the ground of our presidio, as if it just got hit by an earthquake. And this is to remind you that this too is a risk factor for spread of infection. Okay, let's talk about some of the characteristics of the fungus. Like histo and blasto, Coxy is a dimorphic fungi with different forms and different temperatures. And you better remember what this symbol is for this dimorphism. Right, it's a butterfly. So we'll add that here. Now, for histo and blasto, we use the phrase mold in cold and yeast in heat to differentiate between the fungus outside of the body and inside the body. While Coxy is dimorphic, it doesn't exactly follow this adage. It is a mold in the cold. However, when it's in the body, in the heat, it's actually a spherule of endospores. Eventually, these spherules rupture and release endospores, which are then spread throughout the lungs and possibly the rest of the body. To demonstrate this spherule packed with endospores, we've drawn these tumbleweeds. See how it looks like there are little circles in these big spheres? This is very similar to what you see in smears. And the last thing we want to bring up regarding these spherules is their size. It's not important to know the actual size, but you should know that the spherules are larger than red blood cells. Remember, we said histo was significantly smaller, and blasto was the same size as red blood cells. So that means Coxy is the largest. And we'll represent this by having a red sombrero blowing in the wind and rolling right next to this tumbleweed. Since we have it positioned on its side like this, it looks somewhat like a red blood cell. And you'll notice that it pales in size to the tumbleweed, or spherule. So what are the clinical features of San Joaquin Valley fever? In the majority of healthy people, it's actually asymptomatic or subclinical. However, in some, it can present as a self-limited acute pneumonia with fever, sweats, and arthralgias that can last for a couple of weeks. To demonstrate this, we have a soldier here kneeling on the ground. He's bent over, coughing to represent pneumonia, he's sweating to represent fever, and he's hitting his knees on the hard ground, which is causing him knee pain or arthralgia. So that's easy enough. But let's discuss the lung involvement just a little bit more. Here on the left, we're going to draw in some cracks on the adobe wall. Oh, weird. Notice how the cracks kind of form an outline of the shape of the lungs? What a coincidence that this happens in every video. Anyway, with Coxy infection, radiographical images can be unremarkable in the majority of patients, but others may show some cavities or nodules, or both. And we're demonstrating this on our adobe wall with bricks that are caved in to represent cavities, and other bricks that are protruding out of the wall to represent nodules. Another symptom that goes along with Coxy is erythema nodosum, an inflammatory condition that can lead to the formation of red, extremely tender nodules, usually on the shins. You may remember something similar in histo, but this is really probably more associated with Coxy than it is for histo. But really, you're going to use geography to distinguish these two clinically anyway. We're going to make these pillars on the presidio resemble shins, to remind you where the nodules usually form. It's really important to remember that erythema nodosum symbolizes a robust immune response, so it's only generally seen in healthy people. So since this is your third systemic mycoses, you should know the drill by now. We've just talked about what happens to healthy people with infection. Now it's time to talk about what happens to the immunocompromised. Just like in blastomycoses, we're going to demonstrate the dissemination of the fungus by drawing a famous statue here on the right. This is Junipero Serra, the famous mission founder of missions all over California. Why do I feel like we teach you as much history as we do micro? Well, anyway, as you can see, he has a cane to symbolize that he's immunocompromised. Furthermore, he has cracks and lesions in his skin and lungs, which are both common sites of infection. You can also notice the black wrought iron frame that's exposed in his leg, which signifies dissemination to the bone. Besides invading the skin and lung and bone, the fungus can also disseminate into the meninges and cause meningitis. And we'll help you remember that it can cause meningitis by drawing in a soldier leaning on the immunocompromised statue, holding his head, and wearing a neck brace, to remind you of the headache and stiff neck that are associated with meningitis. To diagnose cocci, some clinicians may be able to get clued in by a good clinical picture and thorough history. However, it really can be tricky to pick up clinically if you're not looking for it. So the most definitive diagnosis is done through a KOH stain or through a culture, even though the culture takes a long time to grow. You can also send off serology to check for antibody titers, as you can for all of these systemic mycoses. IgM against cocci would indicate recent infection. And remember, this is a common theme seen with all of the systemic fungi, so we didn't bog down this drawing by including it. Let's finish up with a brief discussion on treatment, which is quite similar to histo and blasto. So for local lung infections, azole drugs, such as ketoconazole, will suffice. So this is symbolized by our pine cones for the conazoles. So we'll draw in some pine cones from these desert pines. For systemic infection, you unfortunately have to use amphotericin B, a drug with many terrible side effects, but it would be warranted to use in a systemic infection, as fungal infections in the immunocompromised can be potentially fatal. So we've symbolized this with our amphotericin amphibian frogs, splashing around the fountain. And that wraps it up for Coccidioides immitis.